Risperidone is an antipsychotic medicine that works by changing the effects of chemicals in the brain. Risperidone is used to treat schizophrenia in adults and children who are at least 13 years old. Risperidone is also used to treat symptoms of bipolar disorder, manic depression, in adults and children who are at least 10 years old. Risperidone is also used to treat symptoms of irritability in autistic children who are 5 to 16 years old. How should I take risperidone? Take risperidone exactly as prescribed by a doctor. Follow directions on your prescription label and read all medication guides or instruction sheets. Risperidone can be taken with or without food. Remove an orally disintegrating tablet from the package only when you are ready to take the medicine. Place the tablet in your mouth and allow it to dissolve without chewing. Swallow several times as the tablet dissolves. It may take up to several weeks before your symptoms improve. Dose for schizophrenia under 65 years of age. You'll usually start on a low dose of 2 mg. Your doctor may increase this to 4 mg a day on the second day. Most people feel better with daily doses of 4 to 6 mg. You can take it as a single dose each day, or you could take half your dose in the morning and half in the evening. Dose for schizophrenia over 65 years of age. You'll usually start on a low dose of 0.5 mg, taken twice a day. Your doctor may increase your dose to 1 or 2 mg, taken twice a day. Dose for many under 65 years of age. You'll usually start on a low dose of 2 mg once a day. Your doctor may change your dose depending on how well risperidone works for you. Most people feel better with doses of 1 to 6 mg, taken once a day. Dose for many over 65 years of age. You'll usually start on a low dose of 0.5 mg, taken twice a day. Your doctor may change your dose slowly to 1 or 2 mg, taken twice a day. This depends on how well risperidone works for you. Dose for aggressive behavior, 18 years and older. You'll usually start on a low dose of 0.25 mg, taken twice a day. Your doctor may increase your dose slowly to see how well risperidone works for you. Most people feel better with 0.5 mg, taken twice a day. Some people may need 1 mg twice a day. You may only be given risperidone for a few weeks. Dose for aggressive behavior in children 5 to 17 years. Your child's dose will depend on their weight. It will usually start low and may be increased by a small amount every other day. Your doctor will tell you how to increase the dose depending on how well risperidone is working. Your child may only take it for a few weeks. Before taking this medicine, you should not use risperidone if you are allergic to it. Risperidone may increase the risk of deaths in older adults with dementia-related psychosis and is not approved for this use. To make sure this medicine is safe for you, tell a doctor if you have ever had heart disease, high blood pressure, heart rhythm problems, stroke or heart attack, diabetes, or risk factors such as obesity or family history of diabetes, low white blood cell counts, liver or kidney disease, seizures, breast cancer, low bone mineral density, trouble swallowing, Parkinson's disease, or if you are dehydrated. Warnings. Risperidone is not approved for use in older adults with dementia-related psychosis. Do not give risperidone to a child without a doctor's advice. While you are taking this medicine, you may be more sensitive to temperature extremes, such as very hot or cold conditions. Avoid getting too cold or becoming overheated or dehydrated. Drink plenty of fluids, especially in hot weather and during exercise. It is easier to become dangerously overheated and dehydrated while you are taking this medication. Risperidone may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Drinking alcohol can increase certain side effects of this medicine. Risperidone side effects. Get emergency medical help if you have signs of an allergic reaction to risperidone, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Call your doctor at once if you have uncontrolled muscle movements in your face, chewing, lip smacking, frowning, tongue movement, blinking or eye movement, breast swelling or tiredness in men or women, nipple discharge, impotence, lack of interest in sex, missed menstrual periods, severe nervous system reaction, very stiff rigid muscles, high fever, sweating, confusion, fast or uneven heartbeats, tremors, feeling like you might pass out, low white blood cells, sudden weakness or ill feeling, fever, chills, sore throat, mouth sores, red or swollen gums, trouble swallowing, skin sores, cold or flu symptoms, cough, trouble breathing, low levels of platelets in your blood, easy bruising, unusual bleeding, nose, mouth, vagina or rectum, purple or red pinpoint spots under your skin, high blood sugar, increased thirst, increased urination, dry mouth, fertility breath odor, penis erection that is painful or lasts for hours or longer,